Hello, my name is Dr. Ibi. I welcome you once again to this channel Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about how understanding the placebo effect and applying its principles to your well-being can positively enhance your well-being. A placebo is a fake treatment that is packaged to look like an actual treatment. So it induces some positive expectation in the person taking the drug as if it is an actual treatment, so the person can report some positive health outcomes, not because the placebo contains any active ingredients that has medicinal properties. So we can call it a water pill or a sugar pill. It is the expectation, the positive expectation that is induced in the person that results in the placebo effect. Now, some of us might have heard stories such as a patient goes to the health facility, a doctor makes a diagnosis, wants to give treatment, and the patient says, I want an injection. And the doctor puts water in a syringe, injects this patient, the patient reports feeling better. That is a placebo effect at work. The feeling better is not because of the water in the syringe or the pain of the injection. That is a placebo effect at work. Now, there have been some documented studies, placebo studies, that have shown the power of perception, positive expectations and beliefs in the management of medical conditions. For instance, it's been shown that 2 placebo pills work better than 1. A bitter placebo pill works better than one that is not bitter. A placebo pill that is bigger works better than a smaller placebo pill. And it's been found out that in placebo studies, a branded placebo with a known brand works better than one that is not labeled or branded. And placebo injections work better than the pill, and even painful injections work better than injections that are delivered with a good technique, so they are not too painful. This sound like some fallacies or bedtime stories you tell to kids. All right, but in actual fact, there are 2 reasons why we believe, or I believe, the placebo effect is not a fallacy. Okay, number 1, when we are testing for medications, when we are testing new drugs to see if they work, we test them against placebos to make sure that they demonstrate activity better than placebos. In other words, new treatments are considered placebos until proven otherwise. Why do we account for the placebo effects in testing for new drugs? We think the effects are real. And also, we have also realized that it is not just, so I'm making a second point, it is not just an issue of people reporting that I feel better when it comes to the placebo effect. Some imaging techniques called functional imaging techniques are able to detect changes in the body as a result of the placebo effect. We have structural imaging techniques, the CT scan, the X-rays, that just take a shot of a structure, gives a report on it. The bone, the liver, the brain, and so on. But the functional imaging techniques are able to tell blood flowing through a vessel, absorption taking place. They can detect chemical compositions of an area of the body. They can see metabolism taking place, and they could see chemicals like endorphins, which are implicated in some of the reasons why people feel better, okay? Increasing in levels and acting on certain receptors. That's, for instance, a pain medication like an opioid will act on to produce a pain relief. So all these things, all these findings have been observed. So then it is so difficult to say that it is just a fallacy when we make sure that to test for a new drug, you account for the placebo effect. Okay? Now, before I talk about how you can apply the placebo effect to your well-being, I should say that I should make 2 important points. Number 1, it is not in all medical conditions that you can see the placebo effect working. So there are medical conditions, the placebo effect cannot shrink a tumor, cannot remove a lump, The placebo effect cannot kill a germ in an infection, for instance. So many conditions, a lot of conditions cannot be, improvement in a lot of conditions cannot be ascribed to the placebo effect. Usually conditions that have to do with a person reporting a relief like pain, or has to do with thought processes affecting physical changes in the body, like through the stress pathway, is these are the conditions that we usually see the placebo effect working most of the time. So somebody it's anxious, and then the blood pressure is up, the heart rate is increased, the breathing rate is increased. You give a placebo, the person thinks I'm giving an actual treatment, and those parameters come down. All right. We can see those things usually in the placebo effect, but not in all conditions. A second point I need to make about the placebo effect is that in medical practice, it is unethical to give placebos. So no health provider or practitioner should intentionally trick you, deceive you that I'm giving you actual treatment when it is placebo. It is unethical. So if it happens that maybe a health provider prescribes vitamins or food supplements for a condition because he wants to, or he or she wants to be seen as giving something to a patient, in case the patient will report some positive outcomes, that is unacceptable. Okay, sometimes you just have to give assurances and not prescribe anything just for the sake of pleasing the person or the patient. Okay, so we use placebos usually and mainly during research, where we are testing drugs, for instance. That's, you can use that, but not to trick patients. Okay, that this is an actual drug, right? So how do we apply the placebo effect in improving our well-being? Now, when it comes to placebos, we know that what the placebos are trying to do mainly are to induce these positive expectations or beliefs in the subject. So that same thing can be done, all right, for a person without tricking the person or lying to the person that this is an actual treatment. For instance, from the side of the health provider, if you increase the confidence of the patient in you, the provider, in the treatment, in the environment, by some form of assurances, counseling, and so on, okay, you get to induce that same positive expectation and belief. All right, that can be an added advantage, okay, to the treatment without lying to the patient to induce those positive expectations. Secondly, also from the side of the patient, now that you know the importance of positive expectations and beliefs in your well-being, you should take advantage of that when you're working with your health provider by getting to know all that you need to know, all the information that you need to know, and being confident in what is being done for you and the outcomes they are expected to produce. And you yourself have some positive expectations about the condition that is being managed. Okay, and I think that you can benefit from the placebo effects without any deception going on. All right, thank you very much for watching this video and subscribe to my channel. Thank you.